Hi, I'm Kath from KathleenRobb.com, and thank you so much for tuning in today. Today, I'm going to talk about what is fatty liver and do I have it? So, this came about because I've recently done a post on what to do if you have fatty liver, and I got some questions back from people saying, well, what actually is it? How do I know if I have it? And obviously, the first way to know is if you get diagnosed, but it's better to find out a bit earlier on and to see if you're at risk of it and to know when to ask your doctor about it. So I think it's one of those chronic health conditions that we have less understanding about. There's a lot like type 2 diabetes and high blood pressure, and there's a lot of these lifestyle conditions that we hear about everywhere, but fatty liver can seem a little bit obscure. And to be honest, the first time I heard about it was more than a decade before I was diagnosed with it. A naturopath who I was seeing told me that I was heading towards fatty liver, and I completely dismissed it. I thought it was just some kind of hippie term that didn't really exist, and I didn't take it seriously at all. And I wish I had, because sure enough, it was real and I had it. And it's a lot more prevalent than we realize. But the good news is that it's very, very treatable in its early stages. So it's well worth considering. And this isn't a video about scaring people. This is a video about empowering people to find out if they have fatty liver, because you can do something about it. You can do a lot about it. So it's worth working out if this is part of your health story. Now, fatty liver is literally the accumulation of extra fat within the liver and around the organs in the abdomen. It can be caused by excessive alcohol consumption, but today I'm going to be talking about non-alcoholic fatty liver disease. So I want to talk about what the risk factors and symptoms are so you can think about if these apply to you and if you need to get it checked out, and why it's important, and of course what to do if you think you might be at risk. So let's go into the risk factors. Now, the number one risk factor of developing non-alcoholic fatty liver disease is an increase in excess abdominal fat. So this is known as central obesity, or we tend to call it the apple shape. So if you are shaped like an apple and you carry extra weight around your belly, that is medically they're called central obesity, and it is one of the risk factors for fatty liver. So this can be a misleading one, because there's a lot of people who on the scales they think they're a healthy weight, but they do have excess fat around the middle or even hidden fat. So we can call this skinny fat, where the person themselves is slim weight-wise, but they are storing fat around the abdomen. Now, when I was in my later teen years, I used to think I got away with surviving on junk food because I was skinny fat. I was smaller than my other friends, and didn't know that I was laying down the groundwork to develop fatty liver disease later on. So my larger friends had to take better care of themselves to keep within a healthy weight range, and so they have stayed healthy. They didn't end up with fatty liver disease. So being skinny fat is not necessarily mean that we're healthier. So some of the other risk factors are if you've already been told that you have insulin resistance, type 2 diabetes or pre-diabetes, if you've had a blood test and it's shown high triglyceride levels, or if you've been diagnosed with metabolic syndrome. So if any of these apply to you, or if you're higher weight for your height, if you're apple shaped, if you carry extra weight around your abdomen, then please have a chat with your doctor to find out if you're at risk of having a fatty liver. So let's look at the symptoms of non-alcoholic fatty liver disease. One of the most concerning things about it is it can be symptom-free for a very long time. So it can actually be progressing without you knowing about it. So that's why if you have the risk factors, just get it checked out. In my case, the symptom that I had was a very, very small amount of nausea most days. So I would have said it was like 1% nausea. It was completely easy to ignore. It was manageable. It was subtle. So the symptom itself was not a problem for me. But luckily, I knew enough to know that if you have nausea, that could be something to do with your liver. So I decided to check it out, and sure enough, I had fatty liver. So please don't ignore any ongoing nausea that you have. Other symptoms that can come up for people are fatigue, bloating, fluid on the abdomen, yellowing skin and eyes, which we call jaundice, an enlarged spleen, which would be tenderness on the upper left side of the abdomen, or if the liver itself is tender, tenderness on the upper right side of the abdomen. So I can't highlight enough though that fatty liver is often without any symptoms at all. So yes, if you have any of those symptoms, please get them checked out. But also, even if you are symptom-free, but you fit some of the risk categories that I talked about, just have a chat with your doctor and find out if you are in fact at risk of fatty liver. So why do I care so much about it, other than the what's in it for me? I had fatty liver myself. So it may seem really inconsequential just to have a little bit of extra fat on the liver. And often the liver can function well enough for quite a few years after fat starts to deposit there, but it's a really insidious condition that unless we correct it with our diet and lifestyle, it can worsen to permanent liver scarring. Now, this can reduce the liver's capacity to function in hundreds of processes, which it takes care of daily, which we can feel very, very sick without our liver functioning at its best. I mean, one of the things that the liver does is it cleans our blood, it filters our blood and helps remove anything that we don't want in there. So you can imagine it becomes like a blocked up, backed up drain without the liver filtering it. So we need that nice, clean, healthy blood to keep feeling well and to live a good, long, happy life. So it's really, really vital that we take care of our livers. Now, even worse, if fatty liver is able to progress, so we don't do anything about it early enough, it can increase the risk of liver and other cancers, of coronary artery disease, of cerebrovascular disease, and liver failure. So it can really have significant impact on our health and our longevity down the track. But like I said, if we catch it sooner, we can really do something about it. And the sooner we realize what's happening with our livers, the sooner we can make the changes needed and take care of this essential organ. So I will be forever grateful that I did get that very tiny nausea checked out, even though I felt silly doing it because I thought, I've barely got a complaint. I just know that nausea is related to the liver. So getting that early diagnosis of fatty liver is a game changer because then you can reverse it and enjoy good health again. And the other good news is that the liver is usually really good at regenerating if you give it the support it needs. So if you were someone who did have fatty liver but it didn't have permanent damage yet, losing weight, living within your body's needs, eating the right nutrients, etc., is likely to reward you with much, much better liver health. So if any of these risk factors or symptoms have rung a bell, getting a diagnosis is really straightforward in the mainstream health setting. You just need to speak to your doctor about your concerns, and if they think that you're at risk, they'll likely run some blood tests and they may send you for an ultrasound scan, which is what happened to me. Now, while you're being assessed, discuss any other metabolic conditions such as your blood pressure, your cholesterol, your triglyceride levels, your fasting blood sugar and insulin levels, and your weight. It's really good to get an overall picture of your metabolic health, and these risk factors often occur together. Now, if your doctor does diagnose you with fatty liver disease, the first thing to realize, or the first steps to take after diagnosis, is to realize that our bodies deposit fat on the liver when we're consuming too much sugar, fructose, or processed carbohydrates, or too much food in general. When our intake is more than our muscles can take up for the energy they need, the excess is deposited on our liver to keep our blood sugar levels stable. So this means the first thing to do is to cut back on junky processed carbohydrates like biscuits, cakes, cookies, ice cream, chocolate, sugar, and even really sugary fruits. So berries are good, but maybe some other fruits to cut back on. Extending the period of time overnight that you go without food can also help encourage the body to access the fat that's stored on the liver for energy rather than just going straight to new food for energy. So this can look like not snacking after dinner And once you get this going as a habit, it might even mean bringing dinner a little bit earlier or breakfast a little bit later to get at least 12 hours fasting overnight. So, this is only an energy fast. You would want to have herbal but not fruit teas and water, or even black coffee, as long as there's no sugar in it, because they don't interrupt the fast. So, you want to keep your fluids up, but just not bring in sugary foods or calorific foods. Now, the other really useful thing to do if you are diagnosed is to increase movement and exercise, because that encourages the muscle cells to uptake extra energy from the food you take in, which reduces the tendency of our bodies to deposit fat on the liver and the abdomen. So, if you're not clear on the dietary steps to follow to support your liver health and you are concerned about your liver, I would suggest talking to a nutritionist or a naturopath like myself to make a plan for restoring your liver health. So, the steps that I've highlighted will help you to reduce any extra weight. There's no pharmaceutical remedy for fatty liver. It's essential to embrace diet and lifestyle change and natural therapies to restore your liver's health as much as possible. I do have another post about fatty liver, so click over to that one. And if you have been diagnosed or you're concerned about your liver health in general, feel free to book in a free discovery call to find out what naturopathy can do to support you and your health goals. Until then, have a great day.